So guys, Dr. Pranka here. We were talking about ICE earlier on with one of the guys who came for one of their mocks, weren't we? And they were doing, what did you call it, quite a formulaic ICE?
Yeah, so quite a rigid structure to their ICE.
So we thought we'd do a quick demo of the third Arora bubble ICE and how to do it with reflection, and how reflection makes such a big difference when it comes to these things. Because remember with ICE, anyone can ask IC&E, but it's about, does it look natural? Does it look like you're really interested in that patient? Does it look like I'm doing it just to get the marks? So what we're going to do is we're going to do a demo of just ICE. Imagine you've done our red flags, we've done psychosocial, we've done the history bit. It's just that ICE bubble. And we're going to do it in a not so good way first, and then we're going to repeat it in a hopefully better way. Sound good?
Yeah.
So what was your name? Patient-wise, I've forgotten.
Mine's Elsa.
Elsa, and you came in with back pain, you said?
That's right.
So as a youngish person, coming with back pain, we've done red flags, we know it's nothing worrying, we've understood how it's impacting her in her life, etc. And I'm just about to go into that ice bubble, right? So Elsa, you've had this pain for a while now. What do you think this might be?
So I think I've got something called sciatica. One of my friends had this, and she mentioned it.
Okay. Was there anything that you were worried it could be?
So I'm a bit worried that, it might be, you hear about disc prolapses and people can become paralysed. I'm a bit concerned about that.
Okay. And was there anything that you're expecting from me that you wanted me to do?
If I could get a scan, that would be great.
Oh, right, okay. Probably not, but okay. Done. How is that as a patient?
Didn't listen to me.
Yeah, exactly. Sounds horrible, right? But we see this so often, don't we, in the academy? People just coming in and literally doing an idea of concern and an expectation question, getting an answer and just moving off as if they've done their job.
Yeah.
But the patient's left feeling, not listened to. As if I felt as a doctor that I wasn't being bothered myself. So you can imagine how it might appear to somebody watching or listening on the other side. So let's repeat that now. So same patient, same details, and let's try and do it with a bit of reflection. Let's try and do it with a bit of genuineness, and let's try and make it interpersonally a little bit better. So Elsa, thanks for answering all those questions. I know I asked you a lot. You've obviously had this for a long time now, and you've come to see us about it, so clearly it's a big thing. What were your thoughts on all of this? What was going through your mind?
So I was thinking it might be a condition called sciatica. One of my friends had it, and she mentioned it to me.
Okay, yeah, sciatica is really, really common, and a lot of people have sciatica, and you mentioned your friend did, so I can see why you think that, and we can kind of figure out if that's what's going on or not, but that's reasonable. You obviously come to see us, it's obviously impacting you in some way. Was there anything that was worrying you about all of this?
Yeah, so I'm a bit worried about, I think it's a disc prolapse. You hear in the news people can become paralysed or have long-term effects from this. So I was a bit concerned that it might develop on.
Yeah, I think an actual worry. You do hear people who have back pain have these sorts of things and can be quite serious. I can see why that's on your mind, and hopefully we can reassure you about that once we've examined you and gone through a few things. But yeah, that does make sense. And obviously you've come here, I know you mentioned you've tried a few painkillers and things yourself. Mm-hmm. Was there anything that you thought that we could add to all of this or do in particular today?
Wasn't sure, maybe like a scan.
Yeah, reasonable. We do scans for lower back pain. It's something that we do organise, not in every case, but maybe once we've examined you, we can have a chat about that. It seems like a reasonable thing to come with. So, how did that feel? Different?
Much better. I think as a patient, it felt much more comfortable to speak to and tell you things. I felt listened to. Yeah. It was definitely much more genuine.
Good, yeah, and it felt as a clinician, it felt like I meant it more.
Yeah.
But did you guys notice how it wasn't? I changed the question a little bit, but it was more the reflection of the answer that made the difference. And I don't know if that came across to a patient.
Yeah, massively.
It shows that I really wanted to know what was in her mind, as opposed to I need to know to pass an exam. Mm-hmm. That's a big thing. And also the questions were slightly different. So in the first one, I don't know if you realize, my idea question was, what do you think this might be? And you answer was sciatica because that's what you thought. And a lot of people do this, but in the second one, I was a bit broader, wasn't I? Tell me what's going through your mind. What are your thoughts about this? Because remember, the ideas is not just you've got a symptom, what do you think it is? It's just give me the thoughts that are in your mind. That can include what's going on, but it might include other thoughts as well. I'm trying to understand health beliefs, and therefore a wider question like tell me what's going through your mind, what's happening in your mind might be a better way. Concern question, I don't know if you guys picked up on the difference. The first time I said very directly, is there anything that you're worried this might be? And you said disc prolapse. But say the worry had been, I don't know, am I going to lose my job? And I'd asked the question, is there anything you're worried this might be? What might you have said?
I don't know, I would talk about my job.
Exactly, yeah. You would have said, no, not really. I think it's sciatica. And therefore I would have lost that worry of the job. So that's why you want to ask a much broader question. Is there anything that's worrying you about all of this? And then Dr. Priyanka could have said either or. She could have said, well, I'm really worried that it might be a disc prolapse, but she could have equally said, I'm really worried that I might lose my job. Because remember, the idea about ICE is to find out any worry in their mind, not just you've got a symptom, is there anything that you're worried this might be? And expectation, I think it was a fairly similar question, wasn't it? But do you notice how I mentioned already some of the things that she'd already done to show that I've picked those things up already? So I know that you've tried some painkillers, you've given a few things a go yourself. Was there anything that I could maybe add to all of this? Yeah. That's very different to someone saying, okay, you're here, what do you expect me to do? Right, so these things make a difference. And when we talk about interpersonal skills, remember there's data gathering and there's interpersonal skills. Data gathering is, do you get the data? So if you ask ICE and you get the data, that bit can be ticked off. But alongside the data gathering, I want interpersonal marks as well. And interpersonal comes from these sorts of things. Now, you can do a lot with ICE. You can try and make the question sound nicer. You can split ICE up to make it more interpersonally better. You can try and do it at the beginning or versus the end of the case. But none of these things really make that much of a difference in terms of how it comes across to somebody watching or listening. That's why the reflection of the answers is probably the most powerful thing that you can do in ICE to show genuineness to the patient, sound genuine yourself when you're doing it, and certainly sound more genuine to somebody who's watching, listening, assessing. So hopefully that helps. If you're going to do roleplay practice tonight in your study groups with your friends, think about this, think about reflection, think about the actual question that you're answering. Priyanka, anything to add?
No, I think you've covered it.
Have you seen this type of thing being done in mocks? Have you seen people do different approaches?
Yeah, and that you can tell like people that have maybe had their first mock and it's been relayed back to them, maybe try to reflect a bit better. You can definitely tell it's their second mock, and because you can hear that reflection, especially when they're doing ICE or they bring up a different question, psychosocial questions. If they're constantly reflecting as a patient, you just go like, wow, I've been listened to.
Yeah, it's one of the big things we teach at the Academy, guys. If you're coming to the Academy, we're starting again in 10 days, 5th of August, something like that. We'll see some of you guys then. Otherwise, hopefully we'll get to meet you at some point in the Academy in the future. Thanks, Dr. Priyanka. See you soon. Happy icing.